People, hello and a wonderful good afternoon from Bavaria. And I'm going to welcome you today to a wonderful session on trichoscopy. You see that I'm missing my dear colleague and friend Catherine today with us. She is today having an appointment outside of the company. She cannot be here, but she sends you best regards. But I have got, instead of that, a lot of wonderful people joining us for this session, experts, doctors from the unique Trichology Club. We met each other over the last year. Let me welcome from Brazil, the team of Trichology Club. One by one, we have got Yanna, Bruna, Rodrigo, and of course, Leo. People, welcome. Welcome to this wonderful session. How are you?
Hi, Moha.
Nice
Hello,
hearing.
everyone.
Hi,
Greetings from
Moha.
Brazil.
My video is disabled.
Your video is disabled. That's an interesting
Hello.
point. But we still, you're right, I cannot see you, but I can see Yanna, I can see, now you're here. Now you're here. Very good.
Okay. Now I'm here.
People, thank you so much for accepting our invitation.
It's
Well,
our
thank you for
pleasure.
having us, Moha. It's a pleasure to be here with FotoFinder and everybody from the crew.
Guys, can you quickly tell us where you are connecting from? Which part of Brazil?
Well,
Okay, I'll start. I'm connecting from Rio de Janeiro, the wonderful city.
Me too. Me too.
Okay.
Bruna also from Rio. Me, Yanna, I'm talking from São Paulo, the biggest city of Brazil.
Okay.
Yeah, and the middle part of the Brazil, in the capital, the Brasilia.
Okay, guys, this is a very important information. I bet majority of you didn't know that Brasilia is the capital of Brazil. Most people think it's Rio or Sao Paulo.
That's true.
Guys, let me tell our audience the intention and motivation behind inviting you. I have been following the Trichology Club since the pandemic, and I must tell you honestly, I have not found any platform that has had continuous good contribution, continuous professional contribution. You're doing an excellent job. I believe your weekly events are in Portuguese for the Brazilian audience. Is that true?
Yes, they're in Portuguese, yes.
And guys, we see, of course, based on that and many other aspects that we will hear during the sessions today, Brazil is an incredible market for hair treatment, right? It's one of the biggest in the world, correct?
Yes.
Yeah,
For sure. I'll talk about that in my lecture, actually, because in Brazil, we have lots of women and men complaining about hair. Due to our weather, actually, Rio is probably the worst part in the world to have hair.
Really,
Because
that's
of
okay.
the
Bruna,
humidity.
it's exciting. I'm really interested in your session because that's gonna be very interesting to hear why this is the case. But again, let us look at it from global point of view. You know that every year at IMCAS, we as FotoFinder are invited as a technology partner to talk about AI, artificial intelligence, how this can be an added value in the daily work of doctors. And this year I was having Sergio Vagno in the panel. Sergio is from Madrid. He does also a great job there. And he said that the actual growth in interest at the level of even IMCAS participants is massive in trichology and in hair treatments. So my question to you, is it due to the fact that there is more and more available treatments? Is it because the pharmaceuticals are investing more? Is it because the treatments are becoming more effective, or just because the patients have more awareness? What is it?
I think it's a combination of facts, Moha, but for sure, if you compare, dermatology in the 70s, for example, and nowadays we have much more effective treatments. It's something exponential. So you have, first topical minoxidil, and then you have finasteride and oral minoxidil, and then you have effective treatments like procedures. And now for alopecia areata, we have so many new effective treatments. So with that, there's a growing interest from dermatologists to treat patients with hair disorders. And in the industry, when they notice that there's like a big field, in need of new drugs, and there are effective drugs, so there's more interest from the industry. And so I believe so. Yes, it's exponential. If you compare the number of dermatologists nowadays that are interested in hair disorders, it's huge compared to a few decades ago.
But Rodrigo, let me maybe stress one point. I just came back from a trip in the Middle East, in Saudi Arabia, and also there the interest is incredible. I mean, it's growing. But I must be honest. I must be very honest from the feedback I got from patients and doctors, that as a very big number of treatments just are not effective. They don't work. The patients are not happy. The doctors are not happy. And in many cases, we realize that it's about missing capabilities of diagnosis, missing, maybe not that in many cases it's not the doctor that does the diagnosis and helps the patient. It's sometimes people who are not physicians, or not hair experts. So I say generally one of the intentions of FotoFinder in investing in education is that we know that patients of alopecia, any kind of alopecia, are in good hands when they meet doctors, the dermatologists. Okay, this is in my opinion a very, very crucial point. And not every dermatologist is a hair expert. That's what we know. And many dermatologists tell me if I do hair, I must also become an expert in psychology, because it's very complex compared to skin. It's also a very interesting comment. But our contribution as FotoFinder is to team up and have collaboration with you as Trichology Club in order to add value at the level of knowledge and diagnosis, and updating our dear friends, our dear FotoFinder and DermLite fans out there. This is the motivation behind this session. I'm very excited to hear your talks. We have got 4 beautiful presentations, and I believe we start with Rodrigo. Is that correct?
No,
Leo.
first is Leo.
Leo.
Leo. We start with Leo. Wonderful, wonderful. Leo, tell us, what have you prepared for us?
Leonardo?
Sorry, my internet is not good. Okay, I will present about the how to take good pictures to trichoscopy and even to
Clinical
clinical
picture.
pictures.
Hmm?
Yes, my lecture was recorded. Please, you can begin.
We can start. You recorded it because you anticipated the internet speed. That's very wise. Very good. So people, we will watch the session. Please add your questions when we are back. Definitely we find the opportunity to talk about your questions. Stay tuned and enjoy the show. Please share.
Hi everyone, I'm Dr. Leonardo Abraham, a specialist in hair disorder based here in Brasilia, the capital of Brazil. Before we start, I want to thank FotoFinder and especially Moha for inviting me to be part of the FotoFinder Academy. It's an honor to be here. Today I'll be presenting on how to take the best clinical and of course trichoscopy image for hair disorders. In this lecture, I will cover 3 main areas: equipment and accessories for taking high-quality clinical images, my approach to capturing this image to support effective patient follow-up, tips and techniques for getting the most out of your tools in trichoscopy. To get the best clinical and trichoscopy images, preparing your patients before the visit is essential. I will share the specific instructions I provide to my patients to ensure optimal results. When a patient schedules a trichoscopy, my front desk sends them a preparation checklist. Wash the hair the night before and ensure it's dry for the visit. Remove makeup and any residue from the hairline and scalp. Avoid topical treatments, creams, or leave-in products. Don't use hair camouflage for 3 days before the visit. Avoid makeup on the day of the visit. If hair is dyed, do it 3 days prior and wash properly. Remove hair station or wigs. So let's start by discussing the equipment and accessories I use for clinical photography. Having the right setup is crucial. Ensure the room is well lit, preferably with white light. A blue background is ideal, as dark hair can get lost on a black background. Use a low share for trichoscopy. This positioning makes it easier to capture the images. Now, regarding equipment, of course, a video dermoscopy is best for detailed imaging and follow-up. If you don't have it, you can use a digital camera or even a smartphone. I prefer the Olympus camera, which allows me to attach a DermLite dermoscope using a magnet ring for excellent trichoscopy images. While smartphones can work, they offer fewer features and quality. However, there are phone cases available that can attach directly to dermoscopes, making trichoscopy easier. For parting the hair, I use a narrow tooth comb with pintail end, and for holding the hair during trichoscopy, a thin comb works best. I will show later in this lecture. When securing hair, I use styling clips. For thin hair, silicone-lined clips hold the hair more effectively, like this yellow one here. And for frontal fibrosis alopecia photos, I used covered side combs or hair bands with small tips to hold the hair back securely. Now let's go over some key photographic tips for capturing clear and useful images. Here are two images taken at the same time but with different techniques. In the first, I stood farther away and used maximum zoom. This approach captures more facial structures like the ear, the nose, and eyebrows. In the second, I stood closer, creating a fisheye effect, which narrows the field of the view, like in this picture here. And now compare these two pictures and see that this is the best one. If you are using a smartphone, you can zoom in and stand farther away, similar to the first picture. But note that image quality may be lower than with the digital camera. And let's talk about flash. I strongly recommend using flash for all images to enhance clarity. Even on a smartphone, the flash can improve the image quality and detail. Now let's look at how to take clinical pictures for patients with diffuse alopecia. First, divide the hair in two sections with the combs I mentioned earlier. Then take the following pictures. At 45-degree angle to capture the frontal area. At 9 degrees to capture the middle of the top. From the back to capture the occipital protuberance, and for telogenous effluvium, add a picture of temporal area by angling the patient's head 45 degrees in the opposite direction. If you don't have any hair clip, you can ask to the patient hold their hair. For patients with short hair, use a clip or wet the hair and comb it. For follow-ups, match the condition of the first exam. If wet hair was used initially, continue with wet hair to be comparable. Now let's discuss clinical photograph for frontal fibrosis in alopecia. Using a digital camera with maximum optical zoom improves pictures quality. For these shots, I recommend using a monopod to keep the camera at the same level as the patient. Start a full face shot, then take close-up of the eyebrows, and capture the head at 45 degree and end the set with a head at 90 degree, showing the nasal tip and the ears. Next, take two pictures from each side, one of the full face and a close-up of the upper half of the head. To ensure consistency, align the nose ala with the tragos at 90-degree angles. For those with a FotoFinder portrait stand, you can use it to streamline and standardize these images. In FFA cases, remember to photograph the entire hairline, as the back of the head may also be affected. For patients with plaque alopecia, such as alopecia areata or lichen planopilaris, capturing accurate images can be challenging. Here's an example of a patient with LPP. Follow-up can be tricky in these patients with long hair. With short hair, it's easier. In challenging cases, I may place a small tattoo at the edge of the plaques for tracking specific areas. It's not ideal, but it helps. Now let's move on to trichoscopy for better follow-up, starting with diffuse alopecia. For diffuse alopecia, start the trichoscopy at the midline 3 cm from the hairline. Next, go to 21 cm from the eyebrow along the midline. Document this position to repeat it in the follow-up images. Then, perform the trichoscopy on the occipital protuberance. And for telogen effluvium, take a trichoscope picture 3 centimeters above the ear, and remember to note these locations. As I mentioned before, here's a short video showing how to split and hold the hair with two combs to perform more precise trichoscopy. I put the combs like this and came with the dermoscopy between the two combs and do the trichoscopy here. Following this technique helps achieve a well-aligned trichoscopy image like this one. But if you don't have those combs, you can use your fingers to hold the hair in place. For trichoscope picture, orientation is crucial. Here I'm using Magicam 1000 to perform trichoscopy. With parted along the IO axis, fewer hairs are visible. Instead, on the x-axis, like I will show now, you can capture more hairs, making it easier to count the follicles. Like here, this way is better in x-axis. Here's a comparison. The image oriented along the x-axis shows follicles more clearly than the another one. Look here. Now let's look at my trichoscopy technique for frontal fibrosing alopecia. Here you can see my trichoscopy marking points. I mark the center between the two ears and extend the marks every 3 centimeters to the right and to the left. I also perform a trichoscopy on the eyebrows. On the right side, I oriented the hair from the right to the left. Look for a reference point, like a mole or ruby nevus, like here, to ensure that you photograph the same spot each time. In the center, I orient the hair straight back. On the left side, I oriented the hair from the left to the right, and remind patients to avoid wearing makeup, as it can mask important details. Standardization is essential for accurate follow-up. Consistent methods for clinical and trichoscope images will yield the most reliable results. And that's conclude my presentation. If you have any questions, feel free to email me or find me on Instagram. Thank you again to Moha and FotoFinder for this opportunity.
Leo,
Hi.
people, Leo, I must tell you, your discipline in photography, and I really call it, is a German discipline. This is beyond anything I have seen so far. Really, really great job. Starting this session with imaging and the fact that we need for a scalp even more standardization, maybe when because you do also body mapping for patients of cancer. How do you see the difference? I mean, what you showed us is very much focused on maximum standardization, both with clinical and dermoscopic, right?
Yes, the standardization of the pictures is the best for the follow-up of the patients, even to androgenetic alopecia, but for frontal fibrosing alopecia is essential that you have very good clinical pictures and to see if the hairline is going back, and I think is the best. And for most, I have some special photograph. Maybe in another meeting I can share my pictures with you.
Nice. The reason I believe our audience deserves to see and benefit from your experience is that indeed photography is time consuming. Our goal as FotoFinder is to more and more make it more, let's say, automated using AI tools, augmented reality, all of the tools available to make photography also for nurses. You know, at the end, this is a job that is done in most clinics by nurses. But if the devices are intelligent, the nurses can achieve very good before and after photography. In your case, I know that you are very specific. You control this area very much yourself. And I appreciate it. That's why you are a great teacher for us and a great example worldwide. Very good presentation, people. In terms of questions, I see that you say, how do you disinfect comms between patients? That's an interesting question. Yeah.
I just put some alcohol and that's it. And I have a lot of them.
Okay, so
I have a lot.
I use autoclave machines. We use carbon combs that are able to go through the autoclave machine without melting.
Yeah.
Hey,
For
Yanna, this is very interesting. Okay.
for androgenetic alopecia patients or telogen effluvium, you can just clean it with alcohol. But of course, if you're doing a procedure or if it is a patient with a neutrophilic condition where you have bleeding, where you have pus, of course, you have to do like Yanna told, you have to put them in the autoclave. Autoclave,
Yes.
Yes.
Yeah.
Hey, but this is generally a very interesting hint because we have a kit of Trichology that we ship with our devices, and Yanna, maybe you can send me this via email. I'm interested to see what exactly you use because we might.
Let me show you. Let me show you.
Because I was thinking maybe we use this generally as a standard because we are now a class 2 medical device. You know that the regulatory wise we have a lot of new obligations, and this is maybe really an important topic because disinfection is a key issue.
Something like this, and you put in the autoclave. This is the common.
Okay. No. Yeah, Yanna, maybe if you share the information later on, I will be able to maybe also share it with the audience. Very good question. Whoever was this, very good question. Never came to my mind. Beautiful question. People, let us keep the rhythm. It's wonderful. You warmed us up, Leo. You warmed us up. And I'm interested to see we move from Brasilia to
Rio.
Rio de Janeiro. People, we're going to have the World Congress of Trichoscopy in 2 years in Rio de Janeiro.
Yes. I hope to see you all here in Rio de Janeiro. I'll just do something here. Okay.
Very good.
So today, well, First of all, thank you for the invitation, Moha. It's always good to be here with the crew. Today, I'll lecture on about new treatments for androgenetic alopecia. So in this lecture, I'll discuss what's new about the drugs that we already use to treat our patients with AGA. I'll also discuss evidence from emerging treatments, and then we'll move to what's on the horizon. So what are the drugs of tomorrow? And I'll also discuss an emerging topic, which is treatment of AGA in transgender patients. So about the drugs that we already use. So we have a winner here, which is oral minoxidil. So we all know minoxidil, oral minoxidil was a big game changer. And in the past couple of years, there were many publications about oral minoxidil. So for the first part of the lecture, I'll focus on oral minoxidil. And a very sensible question that we should ask ourselves is oral minoxidil better than topical minoxidil? So this year we had a publication that investigated that in men, and we also have a publication from 2020 that investigated that in women. And for the male patients, authors, they compared 5 milligrams of oral minoxidil to 5% topical minoxidil twice daily. And oral was not superior to topical minoxidil. And in the study that looked into females, they compared 1 milligram of oral minoxidil to 5% topical minoxidil once daily. And again, oral was not superior. And that may come as a surprise because for us clinicians, well, many of us have the impression that oral minoxidil is much better than topical minoxidil. So what could explain that? So first of all, as we all know, we have very poor adherence to topical treatment in real life for most of our patients. So that could be an explanation. But also in the author's opinion, if you take all of the outcomes of these studies together, they suggest a trend toward greater improvement in the oral minoxidil group. So we should see more studies looking into that in the future. Well, about the dose of oral minoxidil, is higher the better? And we had a paper looking into that a couple of years ago. It was actually a systematic review that included 6 studies with doses ranging from 0.25 to 5 milligrams per day. And yes, the higher the dose, the better the results. With higher doses, you get increased hair diameter and density, but you also get higher risk of hypertrichosis and a higher risk of cardiovascular events. Keep in mind that when you are talking about low-dose oral minoxidil, we are normally referring to doses up to 5 milligrams per day in the publications. But, can we go higher? Can we use higher doses of oral minoxidil in our patients? So we had this paper published this year. It was a small study with 11 patients. And in this study, authors, they had patients using 5 milligrams per day of oral minoxidil, and they increased to 7.5 milligrams of oral minoxidil. They did Holter and pressure monitoring before and 6 weeks after increasing the dose. And they only saw a subclinical increase in heart rate, but no changes in blood pressure. We also have a spoiler here. We have an ongoing retrospective study, which I'm participating in, and which is being coordinated by my friend, Dr. Oscar Munoz, okay? So we have around 60 patients with doses ranging from 6 to 10 milligrams per day. And in our study, only 7% of our patients did not show additional improvement after increasing the dose, okay? And so far, no severe side effects. Well, regarding these higher doses of oral minoxidil, so far, keep in mind, we still have limited data, okay? You could consider using higher doses in your clinical practice in a selected group of patients, but my advice, always start with lower doses and only increase if needed and, of course, if tolerated. Well, regarding safety of oral minoxidil, we also had some additional papers. So keep in mind that now I'm discussing the traditional doses up to 5 milligrams per day, okay? So this year we had a couple of studies investigating changes in blood pressure. We also had a study from last year. And if you take all of them together, in a nutshell, there were no clinically significant changes to blood pressure. Okay, so in doses up to 5 milligrams per day. What about using oral minoxidil in patients with hypertension that are already taking antihypertensive drugs? Is it safe to use oral minoxidil? We performed this retrospective study. I participated, and it was coordinated by the Spanish group. It was a retrospective multi-center study. And the conclusion about the safety profile in these patients with hypertension is that it was similar to the general population. We saw a high risk of adverse events in patients taking 3 or more antihypertensive drugs or in patients using doxazosin. So keep an eye for these patients with multiple drugs for hypertension. There was also this prospective study for patients and for hypertensive patients. They also concluded that oral minoxidil was safe in these patients with hypertension. Well, what about sublingual minoxidil? First, what's the rationale of using sublingual minoxidil in our patients? Well, the idea here would be to escape activation of the drug in the liver. This way, minoxidil would be activated directly at the hair follicle. And why is that interesting? Because this way we would have less activated drug circulating in our bloodstream, so we should expect less systemic cardiovascular effects. But is it true? So we had this paper published, but not yet published, it's an article in press, by my friend, Dr. Paulo Ramos. And what he did, he compared patients taking 5 milligrams of sublingual minoxidil to patients taking 5 milligrams of oral minoxidil. And he concluded that both drugs were equally effective, so sublingual and oral minoxidil were both effective, okay? But he noticed that in patients taking oral minoxidil, some of them had palpitations, and he didn't see this side effect in patients taking sublingual minoxidil. So this suggests that we should expect less cardiovascular effects in patients taking the sublingual version of the drug. Well, now let's move on to evidence from emerging treatments. So every day we hear about new treatments with, many promises that they're going to cure baldness, okay? But we should always look at the evidence behind these new treatments and behind these promises. So I'll discuss today Botox and also exosomes for treating AGA. So regarding Botox, what's the rationale to use Botox in our patients with AGA? Well, there are 2 main proposed mechanisms through which Botox could help our patients. Well, first, it could relax scalp muscles, and this way, we would promote a DHT washout. So in very simple words, okay? And a second proposed mechanism is that Botox would have an antifibrotic effect on the tissue, so a direct effect of Botox on the tissue. And this could maybe help our patients. Well, this year we had this paper published by my friend, Dr. Daniel Mello, who investigated the use of Botox in our patients. So he did a split scalp randomized clinical trials with 26 patients. So in half of the scalp, he injected saline, and on the other half, he injected Botox. So he did 25 units of Botox in 1 square centimeter in the frontal, and he did the same on the vertex. And he repeated the procedure in 12 weeks. And then patients were reassessed for results in week 24. Well, he didn't see difference between the Botox side and the placebo side. And he actually saw worsening in both groups, okay? Well, we've all seen studies suggesting that Botox could be medication, could be a treatment for our patients with AGA. But why this difference between study? Maybe there were different techniques that we saw that were used in the studies, but something that this paper brings up is that we should always look on how results were assessed, if measurements were precise, if they were reliable. After all, we have to be sure that this therapy is working for our patients because it is not cheap, right? Well, now I'll move on to a very hot topic, which is the use of exosomes for hair loss. So exosomes are a hot topic in medicine in general. And I'll try to explain a very complex subject in a couple of slides. So exosomes, they are extracellular vesicles, and they can carry message between cells, okay? Now imagine if we could choose the message we want to send to a specific cell. Imagine this was the message: I want great hair density. And this way we could promote hair growth, okay? So that's why exosomes is such a hot topic, not just for hair loss, but also in the treatment of inflammatory conditions, in the treatment of some types of cancer. So they're being studied a lot. So yes, it is a great idea, okay? And in congresses and publications, we can see some passionate discussions for the use of exosomes and against the use of exosomes. And mainly because we still need groundbreaking clinical evidence on efficacy in humans and also on safety, okay? If you're interested in looking and studying more on the basics of exosomes and the current status of exosome therapy, I'm sharing with you these two papers. They're open access. You can point your cell phone here through to this QR code and download these papers. They are very good papers, in my opinion. Well, now let's discuss what's on the horizon. So the drugs that we should expect to be using tomorrow in the future. So I've done a review on the current status of some molecules that are being studied for AGA. So about clascoterone. So clascoterone is a topical androgen receptor antagonist. So phase 2 studies on the use of clascoterone have shown good results. And right now we have ongoing phase 3 clinical trials in men. We also have pyrrolutamide. So pyrrolutamide, it is also a topical androgen receptor antagonist. Phase 3 clinical trials, they were concluded, but the results haven't been shared by the company yet, okay? So we don't have these results. Nonetheless, the company decided to launch pyrrolutamide as a cosmetic product. So you can go on Amazon and buy it. We also have DT229. It has a different mechanism of action. It's a topical androgen receptor degrader. So it destroys the androgen receptor. It doesn't block, it destroys the androgen receptor. So phase 2 clinical trials have shown good and promising results. And there's a recommendation to start phase 3 trials in men. And it's interesting is that it is not a daily application, it's a twice a week application. And finally, we have HMI 115. So it is very interesting because it is a subcutaneous monoclonal antibody that targets prolactin receptor. So a completely novel mechanism of action. Currently, we have ongoing phase 2 trials in men. And what's interesting is that they're looking into subcutaneous injections every 2 weeks, and also they're investigating monthly injections. So imagine that, monthly injections to treat AGA. And now finally, let's move on to an emerging topic, which is clinical treatment of AGA in transgender patients. So if you go to PubMed and type transgender and alopecia, that's what you get, 27 results. So we don't have much evidence about how to treat patients with AGA, so transgender patients. So the recommendations I'm going to bring to you are based, of course, on the most current data, published data, and also on clinical experience. So for AGA in transgender men, my suggestion of treatment is to start with finasteride, 1 milligram per day, and oral minoxidil. Some points to keep in mind. There is a suggestion that we should wait 1 to 2 years to start finasteride in this group of patients because there is a theoretical risk that finasteride could hamper development of secondary sexual characteristics such as the beard in this population. Regarding oral minoxidil, the higher the better because these patients, they want body hair. And remember, transgender men, they can get pregnant. So we should discuss the need of contraception in our patients, our transgender men patients. Regarding transgender women, so feminizing therapy will be beneficial in patients with underlying AGA. Spironolactone is commonly used as part of the gender-affirming hormone therapy. If it is not being used, you could consider adding this drug to your therapy. And of course, consider oral minoxidil, lower doses. If patients, they have laser hair removal, we can go with higher doses. And we can also consider oral finasteride. And I'd like to finish this lecture, invite you all to come to Rio in 2026 for the 4th World Congress of Trichoscopy. So thank you very much.
Wow. Rodrigo, excellent presentation. The only thing I want from you, please, next time you want to invite us to come to Rio, show some more pictures of beautiful city. It's a wonderful place. And I am already betting that this is going to be the most successful World Trichoscopy Congress of all times.
Well, I hope so. Here in Rio, well, in Brazil, we have a big interest in hair disorder and also in trichoscopy. So we do expect a big crowd. And please, not only from Brazil, from all over the world, we are happy to host the Congress here and to have so many of our friends from different countries. And if you come to the Congress, be sure to save some days to visit Rio. It's a beautiful city.
No, it's a must, guys. It's a must. So we will definitely, prior to this event, have the opportunity to do kind of a, yeah, you will participate in our events, our games, and you might even win a ticket to Rio. Who knows? Who knows? It's something that I'm thinking about because at the global level, the interest in trichoscopy and in treatments, effective treatments of alopecia is growing. The number of publications growing, and the way you showed it in a perfect way. And again, our responsibility at the same time is growing to make things just better and more, more effective, more affordable also, more affordable. I've been talking a lot to Leo about this because we know that worldwide, this is a camera that is known for trichoscopy, thanks to Antonella Tosti, Lydia Rudnicka, who started very early using this device for trichoscopy. We know we will talk about optical zoom later on. After the next presentation, I was thinking about guiding you a little bit toward how do we use it. We have ghost functions that allow us to really create very good, also dermoscopic pictures, comparable ones. Leo had this wonderful hint, search for natural, let's say, tattoos on the scalp, like moles, angiomas, very interesting. And I would like to show you how I do on my own scalp, perfect before and after. But guys, your questions make this event interactive and very interesting. I see that we have already in the chat a couple of questions. I asked our experts to read and answer them. We can definitely take time toward the end of the session to go into detail with the questions. But as we see that the presentation were really well prepared, there is an absolute harmony. I would like to continue with our next wonderful city. Where do we go from beautiful Rio? Do we stay in Rio or do we move to Sao Paulo? What do we do?
We moved to São Paulo right now.
Wonderful, wonderful.
That's good.
Guys, it's just 45 minutes flight in real, but it's a very long car drive. It's not like in Germany that you're gonna speed in Brazil, but it's wonderful. Yanna, we are looking forward to listening to you.
Great, let's start here. Let's share my screen. Just a second. Can you see my screen?
We can see your yeah, now we can see it perfectly. Wonderful.
Wonderful. So one more time, thank you, Moha and FotoFinder, for inviting us to be here. And it's a pleasure for us to be here today. Let me just come back. So today my topic is procedures in AGA, in androgenetic alopecia, the present and the future. We are talking about today about some procedures that are very popular here in Brazil. And it's important to keep in mind that the first line treatment of androgenetic alopecia is the clinical treatment. It's very important. Your patients should be on clinical treatment before thinking about second line treatments that are the procedures. So in our experience, we have some indications of these second line treatments of the procedures that are moderate to advanced case to achieve the best possible results, poor response to first line treatment options, low adherence, unwilling, or even contraindication to the first line options, to optimize results, and also to have faster results. So which procedures are we talking about in AGA? Mailing, here in Brazil, we perform a lot of microneedling. That here we use this specific technique that is called MMP. We are talking about it later. Mesotherapy, and also lasers and drug delivery. So let's start with microneedling and mesotherapy. So microneedling has a lot of papers that have been published in the last years, even a systematic review showing efficacy, a really reasonable efficacy. And the mechanism of action is still unclear, but the needle injury may cause microinflammation, may release growth factors like PDGF and EGF, and also promote antigen induction through WNT-B10B pathway. So here in Brazil, our microneedling, our preferred microneedling technique is the MMP. That means in Portuguese, microinfusion of medication into the skin. And we use for this technique a tattoo machine. And here the thought is the tattoo can inject ink into the skin. So we also can inject medications into the skin. So here we will have the tattoo medications into the skin, but associated with the benefits of microneedling the scalp. So we have the two procedures together. We microneedling the scalp, and also we use the medication injection. So this technique was developed by a Brazilian dermatologist called Samir Bashi that has published some papers about this technique. This first one here is about the technique itself, showing how much medication is delivered with this technique. We have also another publications to treat another conditions, dermatological conditions, but we have also some papers published about hair disorders. And we use it a lot here in Brazil to associate these two techniques with the microneedling and the medication injection. And here we have the material that we need to perform this procedure. We need, of course, a tattoo machine. We use here in Brazil this brand that is a German brand called Cheyenne. And here in Brazil we have our FDA approval for this machine for medical use. And we also need a sterile recipient where we will put the medication. an sterile comb, and also sterile medications. And the first step is to part the hair and clean the scalp with 70% alcohol, is the first step. We can do this parting the hair from temple to temple, in men also the vertex. And then we have here the procedure itself. It's important that we don't need any kind of anesthesia. We do not drag the machine. It's very important. Just touch the scalp gently. And the procedure lasts like 30 to 40 minutes. Let me show you. You can see here, we just touch the needles in the scalp gently. And we also can see here the end point that is a discrete erythema. And we can have some bleeding points, but it's not our goal. It's not to bleed, it's just to touch the scalp. And this is very important because the end point, it's mild erythema, so the procedures can be comfortable. When you touch the scalp with a lot of strength, and this is not going to work because the patient will have a lot of pain. It will be painful. So the application is temple to temple, line by line. We can go beyond when you part the hair, we can go with the needles beyond this area. And this is how we do MMP here in Brazil. Let's move on here. This is not our endpoint. Yeah, this is not a severe erythema with bleeding. This is not our endpoint. Our endpoint is a mild erythema. It's very important to keep this in mind. Our protocol is 3 sessions with an interval of 30 days, 1 month, and maybe maintenance sessions may be necessary, mainly in men that are not using 5-alpha reductase inhibitors, because otherwise we use this kind of medication injecting in the scalp in every 3 months. So let's move on to mesotherapy, that is also known as scalp microinjections. It's a minimally invasive procedure that is considered a complementary treatment in hair loss conditions. It's a very popular treatment in Brazil, in Spain, and also in Mexico, and has a good cost benefit. We have some published papers about this treatment, some RCTs, all of them regarding dutasteride injections, and some retrospective studies and the case reports also about dutasteride, and systematic reviews, all of them about dutasteride, but they all concluded that we need more data to establish the real efficacy of this treatment, but yes, it is a promising therapy. We have also this paper published by our colleague from Brazil, our Brazilian dermatology colleague, Bárbara Uzel, that she published about minoxidil injections, only minoxidil injections. It's an RCT involving 58 women. It was performed 10 weekly sessions in monotherapy, as I said. And in this paper, minoxidil was more effective than placebo with a significant P checked by Trichoscopy. But here the problem is the short half-life of minoxidil, because weekly sessions may be not very affordable. And also bicalutamide has a paper published, only one. It's a case series with only 6 women with 3 monthly sessions in monotherapy, but the improvement was very subtle, so I was not very convinced of the efficacy of bicalutamide injection. So let's move on. We have here a little list to talk about mesotherapy, when, the indications, what we can inject, and where, the technique, how to inject, and our protocols. So firstly, when, what are our indications? Mainly AGA. We only do mesotherapy to treat AGA. And here, respecting our indications that we talked before, And what to inject, what we can inject. We can inject medications, we can inject PRP, we can inject multivitamins. Also, recently have been published botulinum toxin, autologous micrografts, and also nanofat. But look, PRP in Brazil is not allowed. We are not allowed to inject PRP in Brazil. And I'm not very convinced of PRP efficacy, but I rather prefer to inject medications. Multivitamins, we have no data at all of injecting multivitamins. And botulinum toxin, autologous micrografts, and nanofats has a very early data that are being published, so we have to wait a little bit more. So in my opinion, in our experience, we inject medications, and we can inject dutasteride, finasteride in women of childbearing age, because we prefer in this kind of patient to inject finasteride because of the shorter half-life, and also minoxidil. So these are our options to inject, and keep in mind that dutasteride is our star because the majority of data that we have is with this medication. So, and where to inject, the technique itself, we will see how to inject, our protocols, and my personal experience with this procedure. So what we need an sterile comb, a chlorhexidine, gloves, vibration anesthesia device, gauze, 2 syringes of 1 ml Luerlock. We can see I use this one with the low dead space. We can see here. We need 2 needles of 32 gauge, 4 millimeter. I use this one. The vibration anesthesia device, we have some options. And the medication, of course, sterile medications with a little bit of lidocaine. I have here dutasteride and minoxidil. So the medications we have in Brazil, dutasteride 0.1%. You can see here in Equals vehicle. We also have finasteride 0.05%, and we also have minoxidil in 0.5%. All of them sterile. So how much to inject? In my personal experience, I use this kind of injection with 0.1 of lidocaine, and lidocaine is not to get an anesthesia, it's just to burn, we have less this kind of burning sensation with the injection, and also 0.7 ml of dutasteride and 0.2 ml of minoxidil. With 2 syringes, total 2 ml of this solution. And keep in mind that this 0.2 ml of minoxidil is just to dilute a little bit more the dutasteride because it's not very aqueous, it's a little bit oily. So when we dilute a little bit of minoxidil, we have a less oil solution. So it's easier to inject and it's less painful to inject also. So the procedure itself, the step 1 is clean the scalp with alcoholic chlorhexidine. The step 2 is part the hair and do multiple lines for injection. I usually do 5 lines, and in men 3 lines, and also the vertex. The step 3 is the injection itself. It's very important to keep in mind that the amount of injection is very important to avoid cicatricial alopecia, pressure alopecia, because of the volume. They cannot be a lot of volume. You have to pay attention of that. It's less than 0.1 ml per point. It's very, very important. I usually inject 0.05 ml per point, 1 to 2 centimeters between the points. We do, as I said, 5 lines in women, 3 lines plus vertex in men, and I use this 42 gauge 4 millimeters needle, so I don't need to inject in 45 degrees. I inject in 90 degrees and has no need of anesthesia. It's very, very comfortable. The pain control, it's very important to choose the less oily vehicle possible. You can see here, it's in Brazil, we have this aqueous vehicle. It's not that aqueous, but it's still less oily than another ones that we see. The minoxidil we use more as a diluter, with an additional effect in turning the solution more aqueous. Prefer comfortable needles. 32 gauge is the ideal one. The lidocaine helps to minimize the burning sensation, and the vibration anesthesia, it really helps. You can use it. Okay, so here is the procedure itself. You can see we can inject the patient. This is the first line. The needle is positioned in 90 degrees. The patient is not having any kind of it can feel something like an injection, but it's not painful. It's very tolerable, and I have no need of anesthesia at all using this technique. Here, this is the vibration, yeah? It's not my finger, it's the vibration anesthesia that it's involved by the globe. And here we go. Let's move on. So our protocol, when I do only mesotherapy, I perform generally 6 sessions with an interval of 2 weeks, but maintenance sessions every 3 months may be necessary, mainly men that are, again, not using 5-alpha reductase inhibitors. And in some cases that are advanced case, maybe these maintenance sessions could be very useful. And finally, I usually associate this mesotherapy with laser treatments that we'll talk about in some minutes in the same session. So the possible side effects, the main one is pain, but using this technique, I have a very tolerable treatment. Sensitive scalp maybe for 1-2 days in some points of the injections. Headache are very, very uncommon, may be one of the complaints. But pay attention because cicatricial alopecia has been published, maybe due to pressure alopecia because of the amounts of medication injected. So pay attention to this. And also anagen effluvium. We had some cases here in Brazil of an anagen effluvium, like an alopecia areata-like cases after injecting a specific kind of dutasteride that here in Brazil, it was a disaster. So pay attention what kind of product that you are injecting. So take-home message seems to be effective and safe, promising option for sure, mainly as a complementary treatment. So some evidence in oral dutasteride replacement, we have the papers of the Spanish group that published about this dutasteride replacement with the dutasteride injections. We do need more data to establish the real efficacy and standardize the protocols. And the right technique is very important. Also, the product choice to avoid complications. So the last topic that we'll talk about today is the lasers in AGA. And laser was demonstrated for the first time to relate hair and lasers in 1967. And this professor saw that these 694 nanometers laser induced hair regrowth in mice. And also in 2005, we saw the first case of paradoxical hypertrichosis published, showing that laser may epilate the hair, but also may make the hair growth. And some 2 years later in Nature, it was published for the first time, the mechanism of wound healing to make new hair follicles. So we have this mechanism of wound healing that we can do with needles, but also with laser to make new hair follicles. So one of the first papers published about this topic was this one that is a very interesting one. It was a preclinical study that made the connection between wound healing by laser and hair regrowth, because we already know about wound healing and hair regrowth, but not wound healing by laser. So it was the first one. They used this kind of mice and CO2 laser, and they found that these kind of parameters, these kind of fluence and density were the best ones. I will show you the pictures. And they found also that increased expression of promoters of the WNT beta-catenin pathway, and also the release of this kind of growth factors. So you can see here that this paper is a very beautiful picture. They show that when we use less energy, 10 millijoules, and the higher density, we have the best results, higher density and lower energy. So on the other hand, when we have here the high energy and the higher density, we can induce scar formation. So we have to pay attention that parameters is very important, because we can induce hair regrowth, but we also can induce scar formation. Here is another paper about this concept of the right parameters that they analyzed in these mice, that high energy can cause directed follicular damage, but otherwise in the low energy failed to induce anagen. So the best combination of energy and density, we have like a therapeutic window for each wavelength, that you have to find this therapeutic window, because if I go too much, I can do scar formation. If I go with a very, very low energy, I can do nothing. So to avoid injury and follicular scarring, treatment effective and safe, we need more study to regarding this kind of parameters. And it's important that this paper has a very, very how can I say, important statement, that they said injury induced by fractional laser could produce both hair follicle regrowth and scar formation in a dose-dependent manner. So you have to find these right parameters. So laser injury can produce this release of growth factors that help in the angiogenesis. We have anagen induction by promoting the WNT pathway. We can increase the anagen conversion. We can do neofolliculogenesis, increasing density, and high density seems to be more important than high density be more important than high energy. Nah, it was wrong here. It's very important the density, not the high energy in using lasers. These are the wavelengths that have already been published in literature. We have erbium glass, 5040 and 1540 and 1550. We have the thulium lasers, the CO2, and the erbium YAG 2940. And all the papers, they address the therapeutic effect of the laser itself and also drug delivery. So this is one of the wavelengths that we have the most paper published. We have a lot of paper published about these wavelengths. So in our experience, Bruna has an experience with the 1540. It's an erbium glass laser called Icon, this platform. She used the handpiece of 15 millimeters. The pulse duration is 15 milliseconds, the energy of 30 millijoules and 1 pass. These are the parameters that she used. This is the application of this laser, 5040. And I have personally an experience with this wavelength. It's 1565 nanometers, the SUFX laser from Lumenis. And I use these parameters with 2 passes in each line. This is here the application. Let me show a video. Line by line, temple to temple. It's a non-ablative laser. It's very comfortable, no need of anesthesia. And let's move on to the next one, the 19287 thulium laser, that now it's my laser that I use right now in these days. We have this paper published with 10 male patients with androgenetic alopecia immunotherapy. This paper is very beautiful, has a very beautiful design, but it has a very little number of patients involved. So this is the very concerning point. They did 12 sessions weekly, and they associated drug delivery. And here is the thulium laser that I use. It's the Laser Ultra from Lutronic. I use this parameter of 3 millijoules, 2 passes, 6 sessions with a 2-week interval. And after the laser application, I do mesotherapy with dutasteride, as I said before. And I also associate the drug delivery of the medications because thulium lasers is one of the most studied lasers for drug delivery. So here you can see the application line by line again. It's very easy to do the procedure. It takes about 20 minutes, 15 to 20 minutes. It's very fast too. And next, we can see some results. These patients were in monotherapy with laser treatments and showing that we can have some good results. And about the CO2, we have only 2 papers published in AGA. Bruna has an experience with the dual dip from Lutronic, this CO2 laser, and she used these parameters. You can take a photograph if you have this machine. And here is the application from the CO2. She never had any kind of hair breakage. She used this fractional laser because it's ablative, so it's a concerning about this to having the hair shafts break. And then the 2940 nanometers, a erbium glass laser and erbium laser. And you have this only one published paper using the Photona. And it was a very, not very well designed because we have only photographs to evaluate the patients and the efficacy. And the patients were not immunotherapy, were using topical minoxidil and Nutrafol. They did 8 sessions with a 2-week interval. So it's very difficult to establish efficacy with this only paper published. So the pre-laser instructions, the very, very important top one is dry hair. I even can say that it's better to have in your practice a hair dryer, because if the patient comes to you with the hair wet, it's not possible to do the treatment because the lasers have this affinity for the water. So you can have hair breakage because in this situation. So we have to have the dry hair. Clean this, we have to have a clean scalp with no sprays, no fibers, and wash the hair only the next day so the medication can be in the scalp, penetrating in the channels that the laser made. So it's a laser, a treatment that has no needles, no pain, no downtime. It's very, very good in this point. So the possible side effects, until now, I have none, any kind of side effects of the laser itself. It's very tolerable, no pain at all. We can have hair shafts breakage, so pay attention. We have as I said, the hair and scalp must be dry, and we have to use the right fluids. As we said, that the right fluence is the right parameters are very important to avoid the hair breakage and also the scar formation. So use parameters that have been already tested in studies and also by your colleagues maybe. Remember that injury induced by fractional laser can both produce hair follicle regrowth and scar formation. So it's very important to keep in mind that you have to use parameters that are already tested. So my final protocol regarding AGA, utilizing all these procedures, I also do MMP 3 sessions plus laser and mesotherapy 3 sessions. And it's a total of 6 sessions to my patients every 2 weeks, and we can alternate them. As we can see here, the first session, we can do MMP, and after 15 days, then we do the laser with mesotherapy, and after 15 days, we can come back to MMP, and then and so on, we can alternate then until we complete 6 sessions. Other procedures are PRP, that here in Brazil is not allowed. We have no allowance to perform PRP in our practice. And personally, I'm not an enthusiast of this treatment. I prefer to inject medication. I think it's more effective. And about exosomes, Rodrigo talked about it today. The exosomes are small membrane-bound vesicles. They can carry various bioactive molecules like proteins, lipids, RNA, DNA. They can transfer these molecules cell to cell and help in the cell-to-cell communication. So they can influence the behavior of these recipient cells. So in medicine and aesthetics, they have been studied for regenerative and healing properties, and has a potential in promoting tissue repair and reducing inflammation. So they have a theoretical effort to study this kind of treatment with exosomes, but today our reality is that it's a not FDA-approved medication. Here in Brazil and in United States, they are approved as cosmetics, so only cosmetics. And we need that they have to be submitted to the new medication protocol in Brazil, in FDA, in the US. And we also have some black box from FDA, some warnings concerning contamination that is really concerning about this treatment. About hair, we have all studies preclinical, only one clinical study using microneedling to apply the exosomes. So we don't know if the efficacy of the study was from the exosomes or from the microneedling. It wasn't a split scalp study, so it's very difficult to differentiate the efficacy comes from who. And with the topical, we have no data at all. And the content, we have a lot of questions to be answered, like the content type, the right source, the best delivery method, the treatment regimen, the amount delivered. So we have a lot of questions to be answered. So I think we need more data to start using this kind of treatment, because it's not only the real efficacy that must be discovered, but also regarding safety concerns as FDA put in the black box. So my take-home message about this lecture today is that needles, lasers, and drug delivery injections in AGA are useful as an additional therapy. Don't forget about the first-line therapy with clinical treatment and the medication, the oral medication. Main mechanism of action of microneedling and fractional lasers is activation of WNT pathway, increase of vascularization. It seems to be safe and tolerable, but pay attention with the parameters, with the volume injected. It seems to be promising, but we do need more data. In my personal experience in the last years, that we have good results. I want to invite all of you to Rio in 2026 to our 4th World Congress of Trichoscopy. And obrigada. Thank you.
Wonderful, wonderful. Yanna, what an incredible presentation. Thank you. Thanks a lot. Good take-home messages for everybody. People, what I'm really impressed about is the number of questions. It's very good. Keep with us, because we will go into taking really time for the questions. Many of them are related. And I believe it's a good choice to do the questions and clinical cases in one pack at the end of the sessions. I would like to before we continue with Bruna, let me guys let me show you something, because in the presentation of Leo, I was very, very interested in listening to the way he does photography. You see that at FotoFinder you have got generally the possibility to use the compare modus for comparing different types of microscopic images on different areas of scalp. Leo has shown very well where he does the markers. In my opinion, extremely useful to even for those who watch this session afterwards. It's a very good example. But what I liked most is the fact that you are able to use the Medicam with a so-called ghost function. I would like to show it to you how I do this, because imagine if you have a kind of a reference, like on my scalp, I have got this mole. And look, when I activate the FotoFinder, I am able to go and find this spot in a perfect way for a wonderful and almost 100% equal photography of scalp. So this is in my opinion something that of course has been used very often in studies. So when we look at the dermoscopic pictures before and after, you are able to do two pictures that are almost 100% identical. Okay. If you do it even on higher magnification, you can even maximize this this standardization, because you can have a closer look at the level of dermoscopy. And of course, higher magnification is where we talk about optical zoom, where we can see very vellus hair, and it has an impact on the analysis. So my understanding when it comes to analysis of mole is that the higher the resolution of the image, which we reach indeed with optical zoom, with the optics of FotoFinder, the better is, of course, the results when it comes to the measurement of hair, especially very thin hair. You see that this is here a kind of a 21 micron image. It's my forehead. That's why I have a large number of vellus hair here in the frontal area. This is statistic can be really interesting, and I think maybe one of the main reasons why nowadays the FotoFinder is often combined with trichoscopy tools. But let me tell you something. If you want to maximize the quality of the clinical picture, of course, we say we need resolution, we need more light, we need the background, etc. And for that, my idea was, with the time, moving toward more flexible way of photography. What we did was the invention of this device, which again, with the time, brought us toward polarized photography of scalp. So what I show you here, what you see here on my screen, is the screen of the iPad that is connected to this device. And when we look at it, in fact, you see that I had taken a picture of my colleague who is here responsible for the technique, for the entire voice and sound, etc. He's a very good case of androgenetic alopecia. And when we see this picture, this is a cross-polarized picture taken with this device, okay? And when we click, let's say, on follow-up, you see the device gives us a so-called ghost function. And in addition, the device also adjusts the light. So the device gives us the light, which is in this case cross-polarized. You see on the right side of the screen, I have got different types of light, cross-polarized, parallel polarized. But the machine reminds, this information is in the memory of the machine. And today I have got, he has a haircut, so I can use his nose actually as a reference. You see this? So I can bring him perfectly in a very good position and take this picture, and basically have a very good before and after photography. Okay. So what I want to say is that at FotoFinder, we try to maximize the standardization effect. Okay. And in this case, even though the patient had a haircut compared to before, we can have a very good before and after photography of scalp thanks to the standardization with these devices. So again, what I want to say is our intention is to say, okay, we go more portable with photography. We use the skin here that many of you might have seen on exhibitions. We use the MISMA. In combination, we can have the maximum quality of the clinical photography. Honey, can you activate the poll that I created before this? Because I would like to know your opinion about the following. For us in such events, it's always good to know how many of you are using trichoscopy or imaging generally in your daily practice. So it would be very helpful if you respond to these two questions. First of all, of course, we know that with good pictures, good trichoscopic pictures, you will be able to do excellent imaging, excellent trichoscopic imaging and analysis. Please help me to understand, do you like to do this with our Trichoscale DX trichoscopy solution, the Medicam that I showed you? Do you like to have more portable solutions? Do you like to do it with your DermLite, connecting it to your phone, as Leo also had mentioned in his presentation? And of course, the other question will be, when it comes to portable, when you're working with in different clinics, how important is it for you that the solution is portable, that you can move it from clinic to clinic, that it is easy to move around without cable? This is very valuable information for us, which helps us also to better and better adjust our technology to your preferences. Okay, very good. Bruna, meanwhile, everybody is trying to answer our questions. Tell us, what is the topic of your presentation?
Hello, everyone. So here I am, and my topic will be on actually hair weathering.
Okay, this is really
let's
a
move on.
very interesting topic, because I myself, I'm more than excited to listen to this one. Okay, guys, we will listen to Bruna. We will come back. We will answer questions. We'll go through clinical cases. It's gonna become even more exciting. Okay, stay with us, please. Bruna, the stage is yours in Rio de Janeiro.
Thank you. Do you hear me?
Yes.
Yes, right?
Yes.
Just do. Why I can't see the sharing thing?
The sharing is under in the line under in the Zoom. There is a green box.
Now I see. Perfect.
You saw it? Perfect. Let's see. Perfect. I think it's now coming up. Excellent.
Just me.
Exactly. You have to go to the presentation modus, and we will be watching your presentation. Very good, Bruna. Stage is yours.
Thank you, Moha, for this opportunity to be here with people from all over the world sharing our experience. So let's talk about this hair weathering. And raise your hand if you have never had a Brazilian keratin treatment. I won't raise my hand. So I'm Bruna Estrada from Brazil, and I've been working in hair disorders since 2008. And what about weathering? As we know, weathering, it's a name that regards to the various mechanical and chemical processes that cause exposed rock to decompose and everything in the nature. But our hair shafts just, they are actually just like what we see in nature. So they have been processed by all the things that we have in our world, but even with all the things that we do with our hairs. So let's take a close look to this. So hair weathering refers to environmental and chemical exposures that our hair shafts get damaged, which impact our hair fragility and also brightness, just as they do in natural world. So what are the villains? The villains in our daily practice, in our private practice, in our hospitals, the people complain are always the big ones: chemical treatments, hair dyes, and hair straightenings, but also the thermal injury, as we see with flat irons, and also with some blow drying, but even with things that we do day by day, as combing our hairs, as rubbing our hairs, as shampooing our hairs, may cause damage to our hair shaft. And this is very important to know and to look for that in our patient clinical history, because sometimes they increase hair fragility and they increase the complaint of our patients. And it's important to know that hair weathering is cumulative and irreversible. So as we can see here in this beautiful picture of a normal hair cuticle that was published some years ago, we can see that when we do the daily shampooing, we see that the hair cuticle gets drier and a little bit damaged than it was before. So yes, shampoo, especially this high negative and high poo shampoos, may damage our hair as well. And how about hair blow drying our hair? Blow dry, after you blow dry for like 15 seconds at 5 centimeter distance, you see that this is the change in our cuticles. So keep in mind that this may be really, really bad for our hairs if you do it day by day, if you do it without the correct instruments that may protect our hair shaft. And why are we talking about hair weathering? Actually, the hair shaft is the big queen of hair weathering, and it always it's a continuous challenge for women, and in Brazil is also for men to keep their visual beautiful and social interactions more getting better with years as we get as we age, as we get elderly. So the hair shaft, it's also important since a long time ago, and it may represent beauty and feminine, as we see in this beautiful paint of Sandro Botticelli, the birth of in the birth of Venus. And also we can see the difference between the feminine aspect of Venus with the long red hair and powerful hair that she brings in her born. And also we can see the impact of the hair frame. Even if we imagine how Mona Lisa, with this thin, not very volumized hair, but you can reach the impact of the hair frame if we imagine Mona Lisa with the curly hair, or even without any hair. It changes a lot. It changes the archetype that we interpret of her image. It changes our image. It changes our social interactions. And also hair shafts, hairstyling have been used in many chats and all the social media, and it's a cause of social interactions between men, women, children, and also it's a eternal pursuit of beautiful hair. And can you imagine the impact in Brazilian women? Actually, when we think about Brazil, we think about these beautiful beaches and sunny days, and this is the expectation that we have our hairs during summer and during our beach days and vacation days, but actually this is reality. Sun really damages our hair, and also the humidity of Brazil, especially in Rio de Janeiro. So it's really challenging to keep our hairs like shiny and with this beautiful volume in Rio de Janeiro, especially in Brazil. And I bring a reflection. What is your level of satisfaction with your own hair? In Brazil, women especially are really, really unsatisfied with their hair. You can imagine that more than 60% of women in Brazil are unsatisfied with the hair, and more than 40%, 44% of them actually do chemical and or physical hair transformations, as dyeing, straightening, and also flat irons, blow drying, and everything that they can do to get this beautiful hair. So it's really important in our society and all over the world, but I do think especially in Brazil, the characteristic of your hair during your day by day. So what do people seek most is actually the beauty, the perfection, and this easy to manage hair. Because when we have lots of humidity, as in Rio, it's really hard to manage our hair. And we do must put in our daily practice with patients to evaluate how anxiety may interfere in this search to have the perfect hair, you know. Sometimes in Brazil it's really, really common. People come and they do need the perfect hair. They don't need any frizz. They don't need any curls. They need this perfect during all the day. And it's really, really tough to have in Brazil. So we need to point out this for the patients, not to look for the perfect hair. So manage anxiety in these patients is very, very important. And so how does hair weathering present itself? So this patient usually complains about dryness of the hair, where the texture changes, loss of shine, and split ends. And another complaint is that my hair doesn't grow. My hair doesn't grow. This come from the bottom, but it just breaks when it gets to my shoulder. And this is an example that I bring to you. So my hair used to be beautiful and full, and the patient decided to add some highlights to brighten up. And that really dried out the hair. So she got a straightening treatment, a keratin Brazilian treatment to improve the texture. And this is the final result. And we used to say that all of Brazilian women maybe once has been through this challenge of doing some chemical straightening and brightening of hair, and then it gets really, really damaged because it accumulates in the hair shaft and it becomes dry and completely different than the beauty of the previous hair. So the patient presents with this broom-like split ends. And if we think of, it looks like the tip of the whole volume looks like a broom because it's broken due to many chemical and thermal treatments. And we may also have this loss of volume that is really different from the beginning. And this is a really good tip that I give to you. I always, in my first time visit of my patients, I always ask them to bring previous pictures, like from a year ago, 2 years ago, 10 years ago, even when I asked them to bring like pictures of their hair when they were children, because it really improves how the hair just came all over the ears, from the hairline, from the volume, and to the tips. So we can see all the evolution of this hair problem of the patients. And it really changes in volume and color. And straightening may always change color because it interferes with the cortex of the hair shaft. And in the cortex, we have the melanin. So if you have brunette hair, maybe if you have any straightening, you may change the color of your hair. And this might also be a complaint of our patients. And what about trichoscopy? Trichoscopy is mandatory in the hair shafts. So not only, as we have seen today with Rodrigo and with Leo, we must see the hair shaft itself and also the tip of the shaft to differentiate the hair damage. So what are the signs of hair damage under trichoscopy? Broken hairs. So we don't have these thin tips. We have these broken tips here. Let me show you. I think you can see here these broken tips with broom. Sometimes it's like broom, as we see here in the bottom. And sometimes we do have this loss of pigment, because when this hair shaft breaks, it loses melanin, and that's why it's white on the tip. And it's quite different from what we see in a normal hair shaft, as we see in here, these beautiful pictures from Dr. Lydia's Atlas of Trichoscopy. And a normal hair shaft has this thin tip. And when we see this broom aspect, we may see also fracture aspect without melanin, maybe, and also this trichoschisis. There's actually a fracture inside the hair shafts. So these are really signs of hair damage. And what about this patient? So this patient comes with lots of short, maybe short with growing hairs. What about them? Maybe they are not new baby hairs or fracture heads. We don't know. And when we put our trichoscope, we can see that in the left side, we see this white, short aspect inside the hair shaft that with the FotoFinder, we can see in higher magnificence. Here's 120 times, like 120 times magnificence. We can see this blurred hair shaft that actually represent the bubble hairs. So Bruna, where are the bubble hairs? Bubble hairs are actually the damage caused by the heat inside the hair shaft. So when you have like high temperatures, you really damage and you really denaturate the protein inside the hair shaft, and this really causes these bubble hairs. And it's, oh my God, nowadays I think I see this in Brazil like twice or 5 times a week. It's really, really common to see bubble hairs in my clinical practice, even in patients that I didn't like take the close look to the hair shafts, and they complained about drying and different tips. And I was like, no, you're okay, you're brunette, you don't damage your hair that much. But no, if you take a close look to the shafts, you see bubble hairs, and you see why the hairs doesn't grow that much, okay? So it's really, really important. And under microscope, under the electron microscopy, we can see these bubble hairs. They're actually the really damaged proteins inside the hair shaft. And it's really important to keep in mind that fragility is worse when you have a kind of disease. If you have androgenetic alopecia and a thinner hair, your hair won't have that much power to like, if you do straightening, if you do bleaching, your hair won't afford this, you know. And always in senile alopecia and always in lichen planopilaris, as we have a lot of fragility and pleated torti, and also in front of fibrosing alopecia. So in patients which have the disease, you must keep in mind that in your recipe, you must have a session to hairstyling, and I will show you later about that. So how we treat the hair weathering. The gold standard is actually to trim damaged hairs, and we should ask them to minimize damage as hairstyling recommendations. And I'll show you in 3 recommendations actually that you should keep in mind and put in your recipe, as I do it in my practice in Brazil. So first, regarding thermal injury, what is the most important thing is actually heat protector. So using creams or leave-ons or sprays that have dimeticone. Dimeticone is actually the most important ingredient that evolves the hair shaft and protects against heat and thermal injury. And this actually it's also important not only when you blow dry your hair, use flat iron, but also when you go to the sun, when you go to the beach, when you go to the gym, maybe. Okay, so using during sun, you also we recommend to use hats all the time because sun really damage melanin and also keratin. It may oxidate these proteins inside the hair shaft, and that's why we get like lighter hairs after the summer. And also regarding blow dry, using heat protectors is a mainstream, but we also should advise to keep a distance of the blow dryer, maybe like 30 centimeters. It's like half of our arm, and less temperature is safer than higher temperature, and this is really important. And increasing millions to the medical recipe, now we have this supersonic neuro that is the really new, and I don't have any conflicts with this, but this really new blow dryer from Dyson that has the sensor, and when the blow dry comes closer to the hair shaft, it decreases the temperature, and when you get like 30 centimeters from the hair shaft, it increases the temperature. So if you have bubble hairs, maybe this is a good option to add to your daily practice and styling, because if you damage your hair with your blow dry, it may really help in your daily practice. And two, hair combing. What about hair combing? Combing the hair is maybe we think it's like easy to comb, but it's not. We always advise them to comb and brush with widely spaced teeth, and this is for me the gold standard of hair brushes, the super brush from Yanna from Italy, but we have all around the world. But it may be like any of that kind of combs with wide spaced teeth. And also from the bottom to the top, we used to try to put from the top to the bottom, but this increases fragility and breakage. And we should start from the bottom and then go to the top. And this is very different from many people, especially here in Brazil, used to do. So this direction from the bottom to the top. And take it easy, especially in children. And in my daughter is the same thing. She has like straight hair and beautiful hair, and she keeps fighting with the comb. So take it easy. Try to teach them how to do it. And with the wider teeth, it's easier than this kind of brushes with very close teeth. And what about making choices? For me, it's the most important things, especially to deal with anxiety of our patients. So making choices will evolve. If you straight your hair, you can't blow dry. So you straight not to blow dry. So try to keep in mind this really, really important. If you straight your hair, try not to blow dry, especially with the styling blow dryers or styling combs, okay? It really increases fertility, especially with bubble hairs. So it's really dangerous. And what about straightening versus bleaching? If you straight your hair, it's probably one of the most damage of your hair shaft. But if you bleach and if you do both in your hair shaft, it really will break. It's a matter of time. So tell the patients about that, and they will choose what fight they will have. It really increases fragility, and you may find bubble hairs and also fracture hair tips. And brunette hair is less fragile than blonde hair, but sometimes it's not possible to change from blonde to brunette. But try to, if you have the opportunity, to convince your patient not to blonde that much, or not to blonde that much in the tips. That is actually the oldest hair shaft that we have. So try to manage those things and advise your patients in the bottom of a recipe that includes all the treatments that we have talked today, and all the things that are important, but also to take a good care of your hair shaft so that you can have this beautiful image in the mirror. And I thank you very much for your attention.
this kind of presentation, to be honest. Really interesting topic. And you mentioned how important this is for the life quality of the patients. Maybe also our biggest motivation investing in trichoscopy. We know that this is a very emotional topic, very emotional topic, and the health of the hair. No, impressive, impressive. Thank you for the selection of the images. Really enjoyed watching your presentation. Really impressive. I liked it, loved it. People,
Thank
I know that
you.
we have a lot of questions in here, a lot of questions. Dear experts, maybe you choose and let's go through the questions because I suppose that is our priority. Please.
Yes, we have a question from Madeleine asking about the dose of oral minoxidil that we start with, and at what intervals do we increase the dose for our patients. So there's a dose range that most of us use. You may see some differences between dermatologists, but how I do for my female patients, the dose range that most of my female patients fit in is 0.5 milligrams of oral minoxidil to 1.5 milligrams of oral minoxidil. But if you need to increase the dose, if you feel that the patient needs more minoxidil and she doesn't have hypertrichosis, you can go higher, okay? And of course, if the patient has hypertrichosis 0.5, you can go lower. For men, the dose range that I use for most of my patients is 2.5 to 5 milligrams per day. Regarding the interval that I increase the doses, it may vary. For example, if patients are coming to consult to do procedures every month in my clinic, I might increase every month if I feel that the results are taking time. But if the patient is coming every 4 or 6 months, then I increase whenever I see the patient.
Okay. We have one here, I think it's for me, from Paul. How deep is the tattoo machine going? Paul from UK. So Paul, let me show you here a picture in my screen. So you can see here, this is a paper from our Brazilian dermatologist that create the technique. This is the paper. You can take a screenshot to read it later. So we have here, the deep is 300 microns, and they reach the reticular dermis. So this is the study that evaluated this information. So the medication can reach the reticular dermis. Okay.
Very good. Good.
Paul also has a question he's sent in the chat. So if doing microneedling, mesotherapy, lasers in patient on oral treatment, how do you know what is doing what and what is adding value? That's a very good question, Paul. We have publications. When we have publications, in order to know what's working, we need to do monotherapy. But in real life, for our patients, we add treatments to add different mechanisms of action. So I don't start, for example, my patients on finasteride to see if it works, and then I add minoxidil. So I start finasteride and minoxidil because I know both of them work through different pathways. So that's what we do with the procedures. Of course, we have less evidence comparing procedures with oral therapy because they're newer, but we do have evidence from them on monotherapy. And Yanna told us during her lecture which procedures they have more evidence and which ones we prefer. So in clinical practice, we add procedures to oral therapy.
Good, excellent. We have got Camila Alves. She's asking about, have you ever inject, what is it called?
Bicalutamide.
Exactly.
I said in my lecture that I have no experience with bicalutamide injection because they have only one study with only 6 patients and the results were subtle. So I have no reasons to inject bicalutamide yet.
Mm-hmm. Very good. Very good.
Yeah, and regarding bicalutamide, even the data for oral use of bicalutamide is still, early. So yeah, we have even less data for injections.
Regarding pictures, someone asked me, Wayo Mohammed asked me, for beginner, we are still not more expert in using trichoscopy. What is your advice? I think you need to start with picturing everything, picture with your iPhone or your smartphone, and you can add some cases that DermLite has to attach your dermoscope and to take pictures. The main position of my lecture is to standardize your pictures, not only take shots. Take shots with the patients in the same position that you can follow up the patients. Even you need to start with the smartphone, then you can move for the FotoFinder big machine that will allow you to compare in front of the patient is much better, of course. And the pictures that Ursula asked me about the X and IO axis to take the picture of trichoscopy. Let us show you. This is the best way to take pictures. We split the hair and take in these X-axis because you see more hairs and you can count with the software that Moha show for us easier, and the software can recognize the hairs easier if the hair is in that, where is the, in that
Yeah.
way. That way is you see less and there is a lot of blur
Yes.
trichoscopy.
You have
Sorry.
less information, right?
Less information, yes.
And Leonardo said something that I really believe in. It's nice when you can show the pictures to the patients because, you know, you have a wonderful technology which has lots of knowledge behind it. And if you keep it to yourself, like the patient's not going to see the value of it, you know? And so I really like to show and explain what's going on, showing the picture to the patient. And I really believe that improves adherence to treatment in my patients.
Guys, the way you involve your patients with trichoscopy is just a different level. It's much more than when we look at the patients of skin. The involvement of patients of trichoscopy is massive. And in my opinion, again, it just, yeah, somehow motivates us to do more imaging and more standardized imaging. Excellent. Should we go for another last question, guys? We are just close to 6 p.m. here in Europe. It's, let's say, the final of our program. Which question do you choose?
Wow,
Bruna.
let's see. For how long can someone take dutasteride and minoxidil? Forever.
Forever.
Okay. That's it.
Lifetime. Lifetime.
Okay.
As long as they want to keep
Yeah.
their hair.
Yeah, this is very important to mention in the first visit. Very, very important.
Yeah. No,
Yes,
people.
otherwise patients will stop it and they'll lose and they say the treatment didn't work. So it's very important to emphasize the continuous treatment. And sometimes they think forever is too long. So you just tell them until we have something better.
Yeah.
Really
Yes.
And
challenging in
there
young
is a
patients.
question, regarding that the minoxidil stop works. Not they stop works. They will reach the maximum that we can get improved, and then we need to maintain the medication to get the
To
to
keep the
have this
results.
improvement.
Very
And
good.
actually, it's
Very good.
not only the only mechanism of action, it's not only the vasodilation of minoxidil. We get, with age, our like hair shafts get thinner and we have less estradiol. There are many, many things that interfere and may look like that minoxidil doesn't get that better than before.
People, let me say something before we end. You guys are unique. I have never had in FotoFinder Academy together with Catherine the honor to have a team that is so harmonized. I mean, you guys know each other well. To all our audience, please check Trichology Club on Instagram. These guys are delivering incredible added value and information. They share it. Sharing is why mankind made it that far. And there are not all experts, I would say, share their entire knowledge. The 4 members of Trichology Club do this, and this is what makes you guys so unique and, of course, a great partner for FotoFinder Academy. I love having you a part of this because the way you change between you guys is fully natural, very authentic. And really, today's sessions were incredible, diverse, perfectly fitting for the actual need of our audience. We do it once a year so far, but we might really go and expand this with you because the interest for hair is growing. At the AAD in Orlando, people, whoever is coming to Orlando, we are planning definitely having something live at the booth of FotoFinder at DermLite in Orlando. But I myself, I could spend another 2 hours listening to you guys with the questions, but I know that our time is limited. We have got here a kind of a rule for the FotoFinder Academy, and the recording will be online on Monday, people. And it's free of charge as usual. This is for you out there. And again, without the experts, it would have been impossible to have such a quality in FotoFinder Academy. Thank you, Trichology Club. Thanks for being there. Thanks for being our partner. And thanks for continuing on your platform, Trichology Club, Instagram. Guys, have a look at it. It's wonderful. People, thank you. That's all I can say.
Thank you.
Thank
Bye.
you.
Thank
Thank
you very
you.
much, everyone. Bye-bye.
Hope to see you soon, everybody. Take care. Enjoy your weekend.
Thank you,
And
thank you,
Trichology
Moha.
Club.
Thank you, everybody.
We are
Thank
also
you.
Guys are
able to answer
wonderful.
the questions in FotoFinder. Maybe we can answer in our Trichology Club in Instagram and also in FotoFinder Academy.
Yes.
Excellent. It will be great. It will be great.
If
Thanks
you
a
are
lot,
talking
everybody.
Portuguese, you can ask in English and you can ask and answer in English.
That's very
Okay, man.
good.
Thank
See
you.
you.
See you,
Bye.
everybody. Have a good weekend. Bye-bye. Bye-bye.